Yeah, you have start.
Okay, yeah, fine. This is my mugshot. And basically, today we have gathered here to learn about rabies vaccination and the recent protocols and the changing, ever changing guidelines. We've been in practice for many, many years, and we've seen different scenarios, different clinical decisions, which are very tricky sometimes to make. Whether you should go in for vaccination, whether you should do, you know, give some immunoglobulins, or whether the child does not need all these vaccinations and just reassurance. And honestly, if you ask me, I'll be very honest and I'll be very candid and say that I have made mistakes in the past, but because of the ever changing guidelines, and every few years, 5 6 years, something new comes up, and to keep abreast with all these recent changes is the reason behind this talk. This management of rabies management of dog bites is not necessarily a pediatrician's domain or a prerogative. It is for everyone, because the person, it could be, your friendly neighborhood RMP also, he also needs to know. But at least before we reach out to them, I think we should be on one page as to what exactly needs to be done. Over a period of time that I've seen, uh, it's very unfortunate, but I do see, quite a few of my friends, my colleagues, even I did it. So all of us have made mistakes or lapses in the past. So let's go ahead. Okay, so one is, today we're going to talk about rabies and what you should know. Okay, it's a very brief introduction. It's a viral zoonosis. Like everyone knows, all warm-blooded animals transmit rabies. That's dogs, cats, jackals, monkeys, horses, sheep, buffaloes, donkeys, pigs, and bats. Right? Now the thing is that the next question which everyone asks is, I've been bitten by a rat at home. I've been bitten by a squirrel. You know, I've handled or treated a patient of rabies or suspected rabies who turned out to be positive subsequently, had developed that acute encephalitic syndrome and then succumbed to it. So, and do we need vaccination? Then we say there's a pet dog. That's a pup, has got the vaccination done. Do we need vaccination for, to protect ourselves? This is where we come in. So, first of all, I would like to say that rabies deaths due to domestic rodents are not reported, have not been reported till date. That means if you're bitten by a rat, it's pretty safe, or a mice, it's very safe. There's no harm in it. All you need to do is give some tetanus prophylaxis and see if you need to cover the child or the patient with some antibiotics. So again, then man-to-man transmission has not been reported except for corneal and organ transplant. So it's very safe to say that if we see a patient of suspected rabies with the classical features, and we've been nursing them, and then subsequently the patient dies, we do not need to get vaccinated. Then the next thing is aerosol transmission. This is seen basically in bat infested caves, which is predominantly in the Western countries and predominantly in North America, definitely not in our country. In fact, exposure to bats does not warrant vaccination in India. We do get to see bats. If you look at the night sky or stand under the trees, you'll definitely see some bat flying across you. So now, what are the modes of transmission? It's very simple. Everyone knows it's through the broken skin. So bites from infected dogs is the cause for transmission of rabies. The intact skin is not penetrable. That means basically, if there's no broken skin and your dog licks you, you will not end up getting rabies or something like that. So contamination of broken skin by saliva of the dog by simple licking. So you got to understand, if it's just you got a broken skin and just the dog licks you, that's enough. And even scratches by a pet dog or any wild animal or cat, even if there is no bleeding, right? So there's a very simple test to find out whether the skin has been broken or not. It's called the spirit test. What you do is take a little bit of spirit, and apply it on the place where you apparently have had a bite or whatever. If it stings, if it hurts, that means the skin has been broken, and definitely you need rabies vaccination. Direct mucous membrane contact of saliva of the dog, of the animal, especially in the anal region and mouth cavity. Now the first question which somebody will ask, look, my 2-year-old just went and drank some milk or water from the dog's bowl. So will I need to get him vaccinated for rabies? This is a very often question which has been asked, at least to all pediatricians. Then someone says, look, we had buffaloes and we've been drinking raw milk, and suddenly we realize that the buffalo has died or the cow has died. So now the thing is, it is not transmitted by milk. So drinking raw milk of an infected animal or even eating raw meat is not considered exposure. So no PEP required. That's post-exposure prophylaxis. This has been, I'll just elaborate it a little more. What happens is this virus cannot survive outside. So even if it's a rabid dog, which is at home drinking from the bowl and the bowl has saliva in it, theoretically, yes, if the dog licks the bowl and immediately the child goes and licks the bowl, he can get it, but it doesn't survive for long. So and second thing, it gets very diluted the moment it gets in touch with the milk or the water in the bowl. So they say that no case has been reported so far by drinking raw milk of an infected animal or eating raw meat, the person has succumbed to rabies. Aerosol in bat infested caves. It's not in our country, but it's nice to know that all you need to do is, if you've entered a cave in which the bats are there, lots of bats are there, that is considered severe exposure. Because it's not necessarily that bat is going to bite you on your hand, it's probably the skull or under your hair. So that has to be treated very, very aggressively. And the fourth thing is organ transplant, like I said, cornea and other organ transplants. So what are the types of clinical rabies? Everyone knows from our undergrad days. We have two types, the furious type, which is 80%, and the paralytic type, which is 20%. Furious type, you have tingling, numbness at the site of the bite, paresthesia, fever, malaise, headache, hydrophobia, aerophobia, photophobia with spasms of the gullet. Aggressiveness, this progresses to coma and respiratory failure, and there's death very rapidly in the next 3 to 5 days. The paralytic rabies, it is again same thing, tingling, paresthesia, non-specific symptoms like fever, headache, malaise, but then you have ascending paralysis, and then which is followed by coma and respiratory failure. However, in this, the death takes slightly longer. It takes around 7 to 21 days. So very interesting thing is, in case you encounter any patient who's behaving abnormally, it's worth it that you just get him a glass of water and tell him to drink the water. The moment the child gets a glass to this thing, he just moves far. He's thirsty, he's agitated, and he moves back. Next is just blow on his face. That's enough. The child will, or the patient will react with absolutely, somehow or the other to get away from you. So again, to sum up, again, rabies, the background is viral zoonosis, transmissions of bites, scratches, and licks on mucous membranes on non-intact skin. Human-to-human transmission is basically through organ transplant. The CFR, that's the case fatality rate, it's 100%. So only 6 survivors have been documented in the world literature, that too with severe sequelae. It's something like we have 20,000 deaths per year, and of which 35 to 40% are children, predominantly in African and Asian countries, and India definitely very high. So to understand how to do it, the WHO and all the other guidelines have come with a categorization of wounds. So we have different categories of wounds. Earlier it was category 1, 2, 3, and that has got slightly changed. In the sense, category 1 is, suppose you're touching or feeding animals and the animal licks you on an intact skin. Please note this, that if it is an intact skin, you don't really have to worry. And the category 2 is nibbling on uncovered skin, minor scratches or abrasions. Sorry, I'm so sorry. Without bleeding, right? Even if there's no bleeding, but if there are minor scratches, abrasions, you have to treat it as category 2. Category 3 is single or multiple transdermal bite scratches, contamination of mucous membranes, and broken skin with saliva or exposure due to direct contact with bats, like we already discussed. So, how do we take care of the animal bite wounds? First of all, the most important is, which is often overlooked, what they do is they apply all sorts of concoctions on that wound, which is definitely not recommended. In fact, it's a big no that you should not go around putting mirchi and haldi and God knows what. So, most important is cleansing with soap and flushing it under water for at least 10 minutes, absolutely running water. So what the basic idea is, whatever the virus is there, you're trying to wash it off. Okay, so follow it up with nicely irrigate the thing with 70% alcohol or povidone iodine. That's our betadine that we use frequently in all our hospitals. It's very simple. But the most important is it has to be done very well. This itself brings down the chances of rabies subsequently by grossly something like around 50%. Of course, antibiotics are required if indicated, and analgesics, tetanus prophylaxis. So, if a person has not received a tetanus shot in the last 5 years, he should definitely get a booster shot. Rabies immunoglobulin has to be infiltrated in category 3 bites. We'll show you a short video also how to infiltrate. So basically, the most important thing is when we are infiltrating, we got to make sure that every wound, even if it's a small 0.5 centimeter wound or a deep scratch, has to be infiltrated with rabies immunoglobulin. So now the thing is, suppose the area is large, and so then what do you do? You have to. We'll come to that later. We'll have to calculate the dose, and then dilute it in saline or any other physiologically buffered solution, and infiltrate in every wound till there is oozing. Don't think that you've injected it, it's coming out, so it's useless. No, that is the correct way to do it. So suturing has to be avoided as far as possible. However, if it's unavoidable, say there's a lot of bleeding and you want to achieve hemostasis, you got to make sure that you infiltrate the rabies immunoglobulin before suturing and make the sutures loose, something like stay sutures, which all these surgeons use, just to approximate the edges. The more you tamper with it, the more are the chances of spread of the rabies virus through the nerves. Just to recap, I think everyone is aware it's not a hematogenous spread. It is spread from the peripheral nerves, goes to the dorsal nuclei in the spinal cord, then goes up to the brain, and then again starts traveling peripherally and predominantly goes to the salivary glands. That's how the cycle is there. Okay, so now the thing is, before we infiltrate, we have to again rinse that place where we have used povidone iodine so that the whatever antiseptic solution that you have used, it does not interfere with your rabies immunoglobulin action. Cauterization should be avoided absolutely, because for a very simple reason is that virus gets trapped in that area and your RIG that you're infiltrating will not reach that place. And moreover, of course, the healing is also becomes bad. So the category 1, like I said, intact skin. So all you need to do is just wound care. Wound care means just wash it off nicely, rinse it with water, soap, and for 10 minutes, and then apply some povidone iodine or betadine or any other antiseptic. So no prophylaxis is required. So category 2, where there's scratches and abrasions, which are not very, very deep, but still, since there's a break in the skin, we have to do a wound care and we have to give immediate post-exposure prophylaxis. Category 3, again, that's all those are severe wounds and the bat exposure to bats, where we have wound care, immediate you have to do post-exposure prophylaxis, and you have to give rabies immunoglobulins. It could be maybe this monoclonal antibodies. The HRIG is immunoglobulin, human rabies immunoglobulin. ERIG is equine rabies immunoglobulin. It's only recently that we've started getting MAB, monoclonal antibodies. And I still remember my days. I have used equine rabies immunoglobulin. We'll come to that. Earlier, because only equine rabies immunoglobulin was available, it was very cheap, I think for 250 rupees or something like that, when the other human rabies immunoglobulin was something like around 5,000. Quite some time back, quite a few people must never have, of you must never have used it. Again, there were a lot of fallacies as to whether we should give it IM. Somebody said, no, let's give it IM. I don't want to infiltrate. I don't like the process of infiltration. I'm scared. So let's give it IM. We come to that whether we should give IM or not. So now, first of all, what is that means? Okay, category 1, category 2, category 3. Category 1, nothing to be done. Category 2, that means there's some broken skin, but the abrasion scratches, you have to give just the vaccine. And the severe, this thing where there's entire full thickness, break in the skin, you have to give, do the wound care, rabies vaccination, and rabies immunoglobulin. So passive immunization, the latest on the block is human monoclonal antibody. So there we have two. They're basically recombinant human IgG1 anti-rabies monoclonal antibodies. This is Rabies Shield, which is by Serum Institute of India. Okay, the other one is it's a cocktail of two murine is mice, anti-rabies monoclonal antibodies, docaravimab and miramimab. We don't need to know that. So we have to know that the first one is basically a single monoclonal antibody. That's the Rabies Shield. So there, the dose is 3.33 units per kg. So it basically, you have a 2.5 ml vial, and it's very safe. There are no adverse events reported. The most important thing is, please remember that the full dose has to be injected, infiltrated as far as possible. If you have it, if you don't have it, we'll come to that as till how long can you do it, right? But the most important part is, please remember this dose. They're not very difficult, easy doses to remember, only 3.33 units per kg body weight. What puts us off is it turns out to be sometimes very expensive, but look at the cost of human life. I mean, this is something like, if a person has rabies, you can forget over and kiss your life goodbye. So, okay, there are no serious adverse events reported. The monoclonal antibody cocktail, which has got two things, it's by Zydus. It's marketed as Twinrab. It has been authorized and recommended by IAP to use it. It doses 40 international units per kg body weight. Again, so okay, it's available in 300 and 600 and 1500 unit vials. You don't really have to know about that. Please remember the figures: 3.33 for the recombinant Rabies Shield thing, and Twinrab, remember, 40 international units per kg body weight, right? And please don't get hassled with too much of this thing. It's very easy to, if you can just Google and forget the dose. I mean, I don't really expect everyone to remember the doses, but remember this: the cost should not be your deciding factor. It is the wound. You can just imagine that it's pathetic that if you lose a child or a person to rabies, who's got rabies immunoglobulin, but the doctor didn't infiltrate all the wounds properly, and then he just passed it off. Right? In the rabies immunoglobulin, you have the human rabies immunoglobulin, equine. Human is again 20, rabies is, equine is 40. Okay, maximum is 1,500 units or 3,000 units. So, like I said, equine rabies immunoglobulin is the cheapest, but there is a risk of anaphylaxis. Obviously, equine is derived from horses. So now the thing is, should we do a skin test or not? Whenever I used to use it, I used to do a skin test. But now the latest recommendation with WHO has come out with is, you can do a skin test. It's your call. But whether, irrespective of the result, you have to give immunoglobulin. Whether it's, if you have equine only, please go ahead. Please be prepared with epinephrine if the person has anaphylaxis. So it is not recommended by the WHO. However, their product insert says that it's recommended. So if you are in India, let's give a test dose at least to cover your end. It should not be that tomorrow that you have to explain to people that why you didn't do a test dose. You did a test dose, but sometimes because the test dose is very fallacious and It just does not predict the anaphylaxis risk, and the price to pay for the loss of life is way beyond the anaphylaxis, right? The monoclonal antibodies, they're expensive, but again, the very large scale production is easy. They're definitely more effective than rabies immunoglobulin. Obviously, very few adverse events, and so there are no animals have been used. So everyone is the PETA and the prevention of SPCA people. They're very happy that no animals have been hurt. Okay, so now we come to active immunization. So active immunization basically means, again, we are giving vaccines. So you got to understand this. Whenever we give vaccines, vaccines is basically you give some, antigen, and the body responds with the development of antibodies. In the case of passive immunization, we've just given antibodies, right? So in this, there are different types of vaccines. Basically, the cell culture vaccines. You really don't need to know all this PCECV and HTCV and purified Viro rabies cell vaccine. However, what you should know is all vaccines that are available, they're good. It is not that the human diploid cell is better, or the purified chick embryo is better, or someone will say Viro Rab is better, somebody will say Rabies Shield is better. The one, it's something like when you take photographs, the best camera is the one that's in your hand, right? So whatever vaccine you have, that is the best. Effectiveness is 100%. I mean, it's very uncommon that we get to see vaccines which have effectiveness of 100%, but this is one of them. The duration of immunity is fantastic with 5 to 21 years. Okay, so there's because of memory B cells, there's a lot of immunological memory. And they've seen that even 21 years later, if you just give one booster shot, the anamnestic response is very good. So now there's something called, okay, we've talked about a rabies immunoglobulin, we've talked about vaccines. Okay, then we'll talk about the pre-exposure prophylaxis. Pre-exposure prophylaxis is basically before the exposure to your rabid animal. So some people have continuous exposure, like people who are working in different labs and who are dealing with the manufacturing of all these of the vaccines and immunoglobulins. Some have frequent exposures, like medical staff treating patients, rabies patients, then zookeepers, and then vets and all these lab attendants. Infrequent exposure could be anybody. One of the poor guy, the postman who delivers mail to you, the courier boys, or anyone on the street. Schedule is very simple. I will not confuse you with a lot of schedules. 0 and 7. Please remember these two dates. So whenever you give the vaccine, you have to give on 0 and day 7. Okay, we'll talk about the exposure later. After that, within 2 weeks, you have a very, very good immunity. And the VNA, they call it, virus neutralizing antibodies, they come up to a very, very satisfactory level. So re-exposure, suppose you get bitten by a dog up to 3 months, you don't really have to do anything because of the pre-exposure prophylaxis that you've taken, the 2 shots. And if after 3 months, you just need to give 2 doses, that's on day 0 and day 3. Day 0 is today. Today is day 0, so today is 7th. So day 0 will be 7th, and day 3 will be 10th. So we should be very, very particular about this schedule. So there are sometimes travelers, they say there is a WHO comes up and says you can give a single visit foresight. That means you give intradermal vaccines in the deltoid, the deltoid and 2 suprascapular. Again, you don't really need to know this. If the person has got time, give him 1 shot today and 1 shot after 7 days. So now what is post-exposure prophylaxis, right? So like we said, contact with warm-blooded animals, rodents. So I think it's very clear. Rodents, you don't really need to vaccinate because till date, they have not found any case of rodent bite which has led to this thing. I was looking it up. Why is it that rabbits? Okay, yeah, rabbits. That's nice. Often you will get people have a lot of pet rabbits, and they come up saying that the children, they got scratched by the rabbit or bitten by the rabbit. Bitten uncommon, but scratch is very common. So whether should we give rabies vaccine or not? So here you got to understand this. Hare, rabbits, rodents, the domestic rodents, the small mice or rats that we see at home, they are not predators, they're prey. So first of all, when they are bitten, okay, I say, okay, fine, the rabbit or the hare or the rodent has been bitten by a rabid dog, right? So then what happens? Okay, I'll say the thing is infected. But first of all, the chances of a rabid dog biting a rat or a rabbit, and the rabbit surviving or the rat surviving is very remote, right? Second thing is, okay, I'll give it to you that okay, the rabbit has survived because they are very fragile creatures and they die, and a rabid dog will not leave a rat in a that he or she has bitten, right? So now the thing is, what has happened is okay. I'll agree with you and say, oh yeah, of course, the rabbit has survived. Now what do I do? So if the rabbit survives, it's got a long incubation period. The incubation period of rabies is, by the way, between can start from 3 days or to 3 months. That's commonest. They say by 3 weeks to 3 months is the best thing, but it can be from 3 days to 3 years, or it can be much longer also. It's got a very long incubation period. So, like if you remember, from the how the process is, it gets bitten, goes to the dorsal nuclei of the spinal cord, goes to the brain, comes back to the saliva. This takes time. So in this time, there's no question of a rat or a rabbit surviving. So that is one of the theories that has been postulated. So now the thing is pet dogs. This is very common. Even I've been having dogs for the past 25, 30 years and have been bitten once or twice. And should we get vaccinated or not? So the first thing they say, no, my dog has been vaccinated. My vet says there is no reason why you should get the vaccine. I fully agree with him. Yeah, very good. Dog has been vaccinated. But they've seen that 8% of the dogs do not seroconvert, right? That means, okay, we need seroconversion, right? The dog has got the vaccine. If he doesn't seroconvert and the dog develops rabies, you had it. 8% is a very significant number. And second thing, the next question they say is, okay, fine, we agree with you. Okay, we'll get the vaccination now. And the pup is we just got the pup, 10 days old or 15 days old, and has scratched my child or scratched me. What should I do? Because pups are really very sweet and you want to cuddle them and all that, but they do it. So WHO has come up with, and the CDC, the yellow book is there for CDC, the Center for Disease Control and Atlanta. They have come out with very clearly that kittens and pups transmit rabies. So if you're getting a pup, make sure that you get the first rabies shot the moment the pup comes to you, and you give the next shot after 3 months and yearly thereafter, which honestly no one does. So please, if it's a puppy bite, or a kitten bite, please get your vaccination. Right. Infants. Are the infants at less risk or more risk? Pregnant women, lactating mothers, should we vaccinate or no? First of all, I'll talk about infants. Infants, first of all, they're careless. They love animals. They're the same height. So they're very happy playing with them. Since the height is small, the travel time for a peripheral bite from an upper limb to the head is very short. And third thing is, the most of the time, infants and toddlers, they generally do not go around telling them, I've got bitten by that. They obviously try to hide it, or they just take it in their stride. Since this is an absolutely dangerous illness, so we've got to make sure that pregnancy and lactation is not a contraindication to vaccine, and you have to give the vaccine, right? Please remember, infants have very high risk, and infants and children, sorry. Pregnant women, yes. Lactating mothers, yes. Okay, so now the patient comes to you and then comes to you for some illness and says, yeah, last month I got bitten by a dog. What should I do? So now the thing is, if the person has been bitten by a stray dog, if you can see the site of wound, it is safe to infiltrate RIG or monoclonal antibody and give the entire course of the vaccine, right? Why? Again, since it's got a very long incubation period, it has to go from here right up to the brain, come back. Okay, this takes time. So, and the incubation period can be, like I said, 3 weeks to 3 months. but it can even go beyond 3 years. It's got a very long incubation period. Okay, so most importantly, if the patient is presenting late, you have to give the vaccine. Earlier, I don't know if many of you know, they said if the patient is on chloroquine, uh, you should not give the vaccine because it's not very effective. So they saw that the VNA titer, that's a virus neutralizing antibody titer, should be just 0.5. So even if the patient is on chloroquine, they say it is still higher. So, and keeping in mind that he's been bitten by a dog, chances of rabies are there, you have to give the person rabies vaccine, irrespective of whether the patient is on chloroquine or not. Consumption of raw meat, raw milk of rabid animal, of course, like we discussed earlier, very safe. You can go ahead eat raw meat and raw milk from a rabid animal. Okay, so lactating mothers, whether you give it on, even if lactating mother develops rabies, chances of the transmission by the human milk are very, very remote. And I think just one case of perinatal transmission and one case of transmission through milk has been reported in the world, which is really insignificant. So it's very safe. You can give the vaccine and the baby can breastfeed the mother. Right. Schedule for the vaccination. Okay. So there are different protocols. I mean, this slide could be suddenly you look at the slide and say too many data, too much of data. So let's not get very confused with too much of data. You got to understand this. The standard schedule that we follow. This is the SN protocol. Forget the name. 0, 3, 7, 14, 28. These 5 days you should remember. Day 0, day 3, day 7, day 14, day 28. These are for intramuscular injections. Okay. For academic purposes, WHO has come up with this modified SN regime, which says, okay, you can just give 4 doses, 0, 3, 7, 14. Okay, don't give the 28 dose, fine. But it has to be healthy immunocompetent persons who have received rabies immunoglobulin or in CAT2 with the vaccine. Okay, so then they say, now missed dose. This is very important. Okay, so the person got his first dose on the 7th, second dose on the 10th, third dose he was traveling, was supposed to come on the 14th. He comes to you on the 24th. So what do? It is earlier there used to be a lot of confusion. Okay, let's hurry up the rest of the doses. No. Or let's start afresh. No. So day 0, day 3 has been done properly. So for the day 7, if he comes on the 24th, so you give the 1 dose on the 24th, then you follow the same interval. Next is after the 7 days, that's day 14, right? So 24th, 31st, and then 14th of next month. I hope this is clear. I'll repeat once more, or in case you wanted me to repeat it afterwards, I can do it. If don't tamper and don't mess with the schedule, keep the intervals as they are after the vaccination from the day the person has come. If he comes for the 4th dose date, consider that 4th dose that was supposed to be on day 14, he comes to you on day 28. Think of that as the day 14 dose, and then next dose again give it after another 14 days on 28. Please remember only these figures 0, 7, 14, 28. This is going to help you. Okay, there's a Zagreb schedule which is not approved in India. Forget about it. Academic reasons, it's intradermal and 2 doses in the deltoid on the left and right on the first day, day 3 and day 28. Okay, so now we have a person who comes to us late. He comes to us after, say, 1 year or 1.5 years. So should we vaccinate or not? So you see now, since it's got a long incubation period, like I said, chances are there is a very strong possibility that he can develop rabies. Okay, but the chances drop very significantly after 1 year. So they say if after 12 months the risk is less, so you may not. We don't say that you don't vaccinate. You may not vaccinate even in category 3, but it's still better to vaccinate since the chance of rabies declines progressively and it's very rare beyond 12 months. But it's always better to be safe. If the patient has come and told you कि भाई काटा है मुझे 1.5 साल पहले, मैं यार लगाई हो, why do you want to take a risk? Okay, so intradermal vaccination, all of us in the office practice, we use only intramuscular vaccination. Intradermal vaccination is, again, it's been approved by the DCGI and has been used. by all our civil hospitals and all that. They use this only. So it's just they give 0.1 ml in the deltoid in the intradermal region. So one very good thing is the intradermal is, if not is as effective, if not slightly more effective than the IM, for a very simple reason, is because there are more antigen presenting cells and more in your skin is more sensitive. It's because of the increased number of neurons there and dendrites there. So that is why the intradermal vaccination is better. However, if a person is immunocompromised, like a person on long-term steroids or HIV or any other CKD or something like that, we should not use intradermal vaccination. Immunocompromised, if that means if you have a C4 is less than 200, or a very low detectable, non-detectable neutralizing antibody, no immunological memory. So even in category 2, हम लोग को RIG या monoclonal antibody देना है, despite wound management, antisepsis, and your full vaccination. In this, we should do an estimation of antibody after 10 days. Okay, so the person has been vaccinated, he comes to us, like I said, he gets bitten again after say 6 months. If the person has received the full dose of PEP, right, he's got these 5 doses of intramuscular injections, and he comes to us more than 3 months, okay, later. So then you just give 2 doses on day 0 and day 3. The rabies immunoglobulin is not required because, for a very simple reason, is already these antibodies are already there. It's circulating in the blood. So there's no point giving rabies immunoglobulin. For the same reason, if a person has been bitten today, he comes to you, you vaccinate, but you don't have rabies immunoglobulin. So what do? But you don't think it's a wild dog thing, a stray dog, a bite, and you have to give the rabies immunoglobulin. So the best is you can give it up to 7 days. After 7 days, there's no point giving RIG because you've given the vaccine, so uske antibodies ban jate hain. So it's redundant to give RIG. In fact, they say if you start giving RIG, the vaccine response of the body's response of the to the vaccine will also get dampened. So ठीक है, तो ये याद रखना है कि 7 दिन के बाद 7 दिन तक हम दे सकते हैं RIG, इसके बाद नहीं देना, जिंदगी भर नहीं देना. So whenever we give the vaccine, you have to be very clear कि भाई अभी हमने इंजेक्शन लगा दिया, 3 महीने तक कुत्ता काटेगा या कुछ भी काटेगा, नो टेंशन. 3 महीने आपने जिंदगी भर सिर्फ 2 इंजेक्शन लगाने हैं. इम्यूनोग्लोबुलिन जो महंगा टीका लगाया हमने, फिर नहीं लगाना है. So okay, we'll skip the slide. Okay, to sum up, it's very simple. So we have pre-exposure, post-exposure, and re-exposure. Okay. Now here I wanted to say this: the pre-exposure, WHO and IAP both say 0 and 7, but we have something called हमारे country is supposed to be endemic. They say by the NCDC, the National Communicable Disease Center, Delhi, has says कि you should get 3 doses, 0, 7, 28. Let's not get confused. देना है 3 दे दो, but 0, 7 तो देना ही है. Okay, so again, post-exposure 5 doses, and the re-exposure after 3 months 2. Simple. The site, it has to be given in the deltoid, intramuscular, or in very small children less than 2 years of age, anterior lateral aspect of the thigh, never in the gluteal region. Very fact that the vaccine take of the vaccine, once you give it in the gluteal region, is not good. So that means the antibody form production is not satisfactory if you give it in the gluteal region. It's very unfortunate that many people give it in the gluteal region. So okay, so the person comes to you for the rabies का injection चल रहा है जी, और third dose के लगाया, I am ठीक है, day 7 को, very good, I'm very happy, very आगे. तो इससे पहले वाले 2 इंजेक्शन ना, वो पीछे पट पे, आपने यहाँ क्या लगा रहे डॉक्टर साहब, बच्चा है पीछे पट पे लगाया उन्होंने, like that means they've given it in the gluteal region. So now what should we do? The injections given in the gluteal region are negated. So you say those 2 injections are useless, and you will not count those injections when you start the vaccination. So that means even if he's come for the 3rd injection on day 7, you'll start the schedule from then. Okay, so to sum up again, category 1, 2, 3. First one has got wound. Okay, if there is a wound, so then you have to give wound plus cleaning of the wound, plus you give PEP. If it is a deep wound, give monoclonal antibody along with this. So immunocompromised, you have to give rabies immunoglobulin even for category 2. Please remember category 2 में सिर्फ हमें वैक्सीन देना होता है, वॉश करके क्या वैक्सीन देना होता है. मिस्ड डोज की बात हो चुकी है हमारी, like we continue as per schedule, keeping the same interval. Suppose a person says, this is something interesting. He says, I started off the vaccine, but then I just stopped after 2 doses. So 0 and 3. So that means he's not had this vaccine at all. So you have to start afresh. Or he says, I don't remember. So please start the entire vaccination separately. So bites from puppies less than 3 months, please vaccinate. Even these newborn puppies, because like I said, even in human being, even in dogs, perinatal transmission has been reported, and the mother of the puppy definitely licks the babies very much. And if the mother is rabid, pakka rabies to andar ghusi gaya puppy ke. Please don't take any chance with your loved ones. Okay, now something very interesting that's come up. These are the last 2 slides. I hope I have not taken too much of your time, but something very interesting, neo vaccines. Okay, so like if you people, all of us know about cervical cancer vaccine and hepatitis B vaccine, HPV and hepatitis B. All these are recombinant vaccines, right? So recombinant vaccines is basically they take they call it VLPs, they call virus-like particles. So that means they're basically protein chains or polypeptide chains which have got the uh, glycoprotein that is there attached to that. So these are very, very immunogenic. Like we are very well aware with our HPV and hepatitis B vaccines. So, but this is just latest in the pipeline. I shouldn't say latest, but it's been coming up since 2018. Okay, so now, so this is a recombinant VLP based, big, high sounding, very high nanoparticle VLP based rabies G protein vaccine. Simple. It's recombinant. So VLP मतलब एक कोई polypeptide है, उसमें वो G protein डाल दिया उन्होंने. That's all we need to know. Okay. The interesting part is this company has said that you need a post-exposure prophylaxis only of 3 doses. This is the only vaccine with this schedule in the world. That's 0, day 0, day 3, and day 7. Okay, it's been launched in 2022 for adults from 18 to 65. So for pediatrics, trials are underway for the age from 1 to 18. So they compared with the existing vaccine. They said efficacy is as good as WHO pre-qualified vaccine. Very good conversion. They say that within 14 days it's as good, if not better than the the other vaccines that we use, the tissue culture or cell culture vaccines that we use. Like this HPV, they say you get a very nice antibody titer. Obviously, you get a very good antibody titer because basically you have just extracted the protein and you're giving a concentrated glycoprotein part of it. Okay, so adverse events nahi hai. So the cost is 750 rupees per dose and the cost is around 2,250. Does it look prohibitive? No, because the other vaccines generally cost us around 400 rupees, 400, 350, 400. They give 5 doses, works to around something like around 2,000 rupees, or this is 2,200. Okay, but then you have the advantage of जो नॉन कंप्लायंस होता है ना 14 और 28 दिन वाले भूल जाते हैं हम 037 में देखे खत्म कर दिया. Now is it approved? WHO has not approved it. IAP and Government of India has not approved it. Sorry, IAP has not approved it. Have not said anything about it so far because it's just come up in 2022 and it's available in the market. I'll come with the name. I'll tell you the name also. But the DCGI has given the approval. Okay, so because basically it's been the trials have been there for the past 3 years, but we don't know the long-term protection. But comparing this with the HPV and hepatitis B vaccine, we think we should be very hopeful that this is going to be a very nice vaccine because there are no hardly any adverse events, and it's absolutely liquid form में है, तो आपने कोई diluent use नहीं करना, ये नहीं करना, वो नहीं करना. Right? Okay. Sorry. The name of the vaccine it's called THRABIS, Thrabis. This is by Cadila. It's available in the market. But of course, if you ask me, I would not like to comment on the usage of the vaccine till WHO approves it and IAB. But it's very nice to know that's available because somebody is going to tell you, sir, ये नया vaccine आया है. But it's your call. You have to take the call whether to get the vaccine or not because the vaccine has been here for past 3 years only. Yes, they have done a lot of trials, but again, trials by all companies. The trial was obviously sponsored by Cadila. I'm not saying anything bad about the Cadila or any other company, but it has to be taken by a pinch of salt. The only thing is, if the WHO, CDC, or IAP recommends it, we can just go ahead with it. Thank you so much for a lovely and a patient listening, and please feel free to ask questions. I think should be fine, because I think I've tried to do it as quickly, and please don't get overwhelmed with so much of data. वो याद रखना 0371428 बस IM लगाना है, ग्लूटियल में नहीं लगाना है, वूंड अच्छी तरह वॉश करना है, सुचर करोगे तो ध्यान से करना, अच्छी तरह इन्फिल्ट्रेट करने के बाद, and make sure that if you got any doubt, please reach out to any of your colleagues who know about it. There's no harm. I mean, obviously, we're not superhumans to remember everything, and we can't trust everything that comes on Chat, GPT, and AI. Thank you so much. Have a great evening.
I'm Dr. Ajay Arora from Gurgaon.
Yeah. Sure, sir. Go ahead.
Very nice presentation by Dr. Ravi. He
Can
covered absolutely so well that he covered all points. Just 2-3 comments from my side. Now, as a government of India and the whole world is trying ZBT. What is ZBT? 0 by 30 dog bite death of rabies. This is very important, that the slogan is ZBT, that is 0 by 2030. The dog bite rabies should be 0. And we know 90% cases of dog bite rabies occur in Asian countries, particularly India is giving so much contribution as far as dog bite rabies is concerned. So my humble request that at uh, district level, at least we should do something for this. That is the vaccination of pets. If we vaccinate dogs 70%, we can eliminate dog bite rabies. And second thing is neutralization of dogs, sterilization of dogs. If there are two things we can do, then naturally we can at least reduce the burden of dog bite rabies. Second thing, regarding, we very well explained pre-exposure prophylaxis and post-exposure prophylaxis. But one very important, that every doctor should at least reinforce what Ravi told, that is wound cleaning and washing. I think if you wash with soap and water for 15 minutes, 50% of virus burden is over. I think he very well pointed out by Dr. Ravi. We should stress this, that proper wound washing is number one. And number two, in India, we are doing 07 and 28 as far as pre-exposure is concerned, because DCGI always say go for 3, not 2. Although Ravi rightly said that for WHO it is 2 recommendation, but in country like India, we want 3 and 5 instead of 4, because we never know the proper the technique and everything. And third thing, he very pointed out, that I reinforce it, that please do not give this vaccine gluteal region. It should be intramuscular, and don't count the gluteal vaccine. And last, if a patient come from say any remote area after 20 days and after dog bite, still you can give anti-rabies vaccine, that is monoclonal antibodies, because he has not taken any rabies vaccine. So the day should be counted 0, because the day when we give vaccine, it should be the time when we can give the anti-monoclonal antibodies. So it is not the days of bite, it is the day of administration of vaccine. Thank you.
Thank you so much, sir. India is supposed to be an endemic country for dog bites. So that is why, despite the WHO saying that you just need 4 doses, we are sticking to 5 doses. That's 0, 3, 7, 14, and 28. I mean, many years back, there was this thing that you can give a dose on day 90 also. That, of course, has been withdrawn. That you don't need to give 6 doses.
Yes.
So actually, I didn't want to confuse a lot of people with so much. But again, basically, if you remember these 5, please remember 0, 3, 7, 14, 28. Please remember this, not in the gluteal region. And there were some questions. Is there any consideration of site of bite? Yes, of course. You got to understand this, like we said, the travel time of the virus to the brain. It's very simple. So, and the place which has got the maximum nerve endings, so antigen presenting cells, like a hands, like a toes, not the back. Back has got less, nerve endings. So, the chances of transmission from the back to the brain are slightly less. If the person gets bitten on the head and neck or the upper extremity somewhere, the peripheries, still, since the nerves are more and the nerve endings are more, so the travel time will be faster. So somebody did a study and they came up with something like 1 to 2 centimeters per day. But this was very arbitrary. I don't know how they did it. They must have done it retrospectively. So, but whatever it is, and like we said, बच्चों में बहुत ज़्यादा ज़रूरी होता है क्योंकि बच्चे छोटे होते हैं, travel time बहुत कम होता है. So we have to give it. And Rabies dosage schedule is the only vaccine which has got 3 doses, but again DCGI has approved it, WHO has not come up with it, Government of India, NCDC has not come up with it, so we don't want to. What about food and utensils? Thank you, Dr. Kamaljeet, for the lovely words. Yeah, food utensils sharing at home post exposure, there's no harm at all. Like I said, this is a heat level virus, and all you do is the moment the can't survive for long outside. That is why there's no transmission through fomites. All these things get transmitted through fomites because they can survive outside the rabid dog. So that's why it's very safe to have the same food. You can share the food. You can have the same utensils also. The next question is from Dr. Prashant. Is how often should pets be vaccinated? Do they need booster doses? Of course, because yes, because routine veterinary practice in India does not endorse boosters despite recommendations. You're absolutely right. Yes. First part of the question is yes, all pets have to be vaccinated. So if all of you have pets, you know that initially they come with 6-in-1, the canine, distemper, hepatitis B, then uh, the parvovirus, influenza, para-influenza virus. They have some 6-in-1, 7-in-1. They've got a schedule, and okay, fine, you can do that. But okay, those are for the dogs. For us, if we are keeping pets, the most important is rabies. So like I said, if the pup comes to your home, first day तो लगा दो आप साथ के साथ, एक 3 months में लगाओ and give yearly boosters. Once a dog becomes an adult, they say the booster of rabies has to be given every 3 years. Honestly, people यहाँ पर हमारे देश में अंदर बच्चों के इम्यूनाइजेशन भूल जाते हैं, डॉग्स का तो बहुत दूर की बात है. Honestly, if you ask me, I say I'm guilty because I also forget. Sunday I remember कि okay, अरे this is that, and they have a very nice dog का, they have immunization card. They call it the passport. It looks like a passport. You open up and then you see that all the schedule is there. Then suddenly you remember that you have not given it for the past 3 years. Then you panic and say, talk to your vet, and then he says, okay, come, let's give it. Okay, so thank you very much, Dr. Deepika, Dr. Soni, Dr. Meenakshi, Dr. Mago, Dr. Ma, Dr. Andal Chariam, Dr. Gunjan. And in India, government use, okay, like I said, Dr. Prashant has again come up with this. In India, government hospitals use intradermal regime. Yes, intradermal regime, first of all, there are a few things. Okay, now as intradermal regime is better, same, or not as good. It is as good, if not better. Because again, like I said, it's intradermal. So the antigen presenting cells, it's got the maximum number of nerve endings. So that is the best place to give it. But the only fallback is the technique of giving intradermal is sometimes not too good, and people end up giving subcutaneous, which is again useless. Right? Please don't give subcutaneous. Either give IM. If you're very confident, give intradermal. Intradermal schedule is again slightly different. Like I said, the Thai regime, that is a 1-1-1. Again, 0, 3, 7, 14. And then 28, 1-1-1 doses. There are different schedules for that. Like I didn't want to bother you with all those schedules of Thai regime and modified Thai regime and all that. But what's more important to remember is, since, we use the same vaccine, same vial, that 0.5 ml vial or 1 ml vial. If it's 0.5, dilute it with 0.5 ml, and they use 0.1 intradermally. That is as effective as as effective as the intramuscular thing, if not better. Right? The advantage is, one is it's cost effective. because with one vial you can give vaccinate 10 people, which is quite a lot. Okay. Second thing is, since it's very cost effective and it's a very good vaccines effective. The third thing is there that if you have diluted the vaccine, they've got to make sure that you have to use it within 6 to 8 hours. That means during the daytime, and then after 8 hours, you have to discard that unused vaccine. Okay, these are the three things that need to be done about. So my views are obviously with the government of India. It's very nice. So we can and we should follow that. But again, all of us can't give intradermal. Oh yeah, lovely. Are mongoose and squirrel, can they be rabid? Okay, this is a very good question, Dr. Mago. Thank you, sir. It's a mongoose, yes. Mongoose is in the wild. Mongoose is a predator. It can kill snakes. It can kill rats. Okay, if it gets bitten, it will survive, and it's definitely very mongoose bites. You can treat it with absolute caution. That take it as a category 3 bite. Obviously, it's not a pet mongoose. It's a wild, and it's not going to just lick you or scratch you. It's going to bite you. So you have to give the vaccine. Now squirrels. Okay, the squirrels, the same thing which I spoke about rats, and what I spoke about hares, rabbits, hares. You see, squirrels also come in the same category, right? How do they come in the same category? They're very delicate animals. Okay, if they're bitten by a rabid thing, one is probably they'll die immediately. Okay, it's very hard to imagine that a dog is going to pick up a squirrel and just let it go. If the moment a predator has taken the squirrel amount, that is going to kill. Okay, some of the squirrel escapes. Again, the same thing like I said for rabbits and hares. Okay, by the time the incubation period, that means the virus travels from the peripheral of skin to the spinal cord to the brain, and then comes back again to the saliva, and then the dog is infected, or the squirrel is infected, right? Okay, in the meantime, the squirrel will have died of either infection. Okay, if the squirrel has not died then, has died subsequently because of infection. So there's no chances of, are very remote. So squirrels in India, it is not recommended. However, this final decision will be yours. If you think it's a very unprovoked and it's a vigorous bite, please go ahead and vaccinate. There's no harm.
I think Dr. Ravi, in case of unknown, sometimes the patient comes and says, "Sir, there's some bite, maybe by the rat or something else." In
Give it.
unknown case, we should treat like a rabies. We should, unless until you are practically confident that patient say that this bite is by rat only. Otherwise, when there is a presumption, we should give anti-rabies vaccine, because in any wild animal, if you do not know the particular animal, we should treat like a
Yes,
give proper prophylaxis.
absolutely, sir. But if the most of the time they say that I was sleeping indoors and I was bitten by something, you presume that it's a rat. There's
Yeah,
nothing else. Yeah.
The,
Okay, that's a very nice
the
question.
benefit of doubt always must go for the vaccination.
Correct,
vaccinations.
correct, sir.
That is the
When in
rule.
doubt, vaccinate. When in doubt, but please vaccinate in the deltoid or the anterior lateral aspect of the thigh, not in the gluteal region. Okay. What should be done? Yes, what should be done if a person develops symptoms of rabies? First of all, it's very sad that there are still people who develop symptoms of rabies, and normally what we do is we send them to tertiary care. Okay, and if you do want to keep the person with you, explain the prognosis, keep the person with you, keep the patient in a dark room, and obviously use sedation, controlled sedation, and hope that the patient comes out. But again, since the sequelae are very bad, so
I think, Dr. Ravi, the rabies patient has to be kept in the IDH only,
yes, sir.
because
Yes.
that post-mortem, all these biopsies and everything has to be done, and they need to be kept in an isolation disease hospital.
Yes, sir. Dr. Goyal has said that no, it's not. It's required for mammals bite and not by reptile bites. I fully agree. It's transmitted by all warm-blooded animals only. But if the person has been bitten by a snake, it's your call whether you want to give rabies vaccine or not. Because I mean, like, I would not be too comfortable that I don't give the rabies vaccine if the person has come any bite. No, obviously not scorpion bite and all that, but yes.